As the 2026 spring semester comes to an end, many students who successfully completed their program are graduating. And for the master's degree in public health at Marshall University, the celebration began with a hooding ceremony. Prior to the start of the ceremony, Professor Anthony Wolf, chair of the Department of Public Health, highlighted the importance of public health education and community service. Some of the successes being the chair of the program for a couple of years.
Oh, well, it's not just a couple of years. I've been chair of this program since 2018. Prior to taking on the department, at that time, we were not accredited. Accredited means it's a recognition that is one of the best programs in the country. So it's a big deal. And then we first got a 7 years accreditation, and just this year we were given another 7 years. So we are accredited until 2032. So this was a
Which means that when
of the accomplishment.
Which means that when students graduate from here, they are
Recognized,
they are recognized.
yes, as accredited institution. It's a big deal for professional schools like public health.
What do you think would be one of the challenges that you have seen over time that the students encounter during the program?
Well, the first challenge we had was during the COVID-19 period. The challenges were we had to create ways by which we can administer the courses. So we created what we call a hybrid program. That means they could take some of the courses online and some in classes. We have a lot of students that are coming from abroad. They have to adjust to the American system and be acculturated, meaning they have to learn the values and norms of the American society, which is different from their respective countries they are coming from. So that is a challenge for them. And for some of the students who are American born, for some of them they are first generation students, meaning that they are the first to go to college in their family, or they're first to go to graduate school in a college. And that's quite an experience.
Yes, Professor, you also run some program within the community outside university, the Minority Health Initiative, where you organize health, minority health observance and stuff like that, where some of your graduates are involved in some of these programs.
Right.
How do you able to mentor students so that they leave the classroom, not just in the classroom, but actually able to maybe utilize the skill that they have learned into the field?
That's a very good question. One of the uniqueness of the Marshall University Masters of Health program degree is that we do have a research institute which gives students the opportunity to do applied research, meaning what they learn in the classroom, they can be applied in the community. We had our greatest success during the COVID-19 incidents when our students were the ones that were going out in the community to teach them how to do contact distancing, social distancing, and then they engage in what we call contact tracing, meaning that they will go out in the community and find out where they have been, who they have been associated with, and that we fed that back to the Bureau of Public Health so that they will create information dissemination about how to avoid COVID. Besides that, we engage in other policy initiatives in partnership with the Bureau of Public Health for West Virginia and also other community-based organizations. As you correctly said, we also on an annual basis organize what we call community health fair, where we bring together community organizations that are engaged in health promotion, and we do that program because one of the importance of public health is that we engage in disease prevention. When you educate the population, then they have the ability to avoid the incidence of diseases.
One of the things is the issue of funding. In order to be able to run most of this program, especially in communities, especially in minority, where I know you carry out a lot of research in that area, how are you able to continue to provide this community outreach program?
Yeah,
in terms of resources, especially finances?
Yes. So that's a very good question. For example, 3 years ago, I approached the legislators that they should assist us through a line item budget, and they graciously provided that and gave us about $100,000 a year that assists in such programs. We also engage in other grant proposals that are funded by the federal government and the state of West Virginia. And this is how we also approach philanthropic organizations that also assist us with funding. So this program is well funded to carry out our community responsibility, which is health promotion in the community. So we are not just teaching theory, but we actually put the children in practice where we make a difference in the community.
Thank you so much.
Meanwhile, some of the graduating students also share their experiences and challenges encountered during the program.
My name is Maria.
Full name?
Maria Paramargas.
Okay. So how long have you been in the program?
This is 2 years pretty much. Yeah, this is my last year.
So far, what have you learned and what kind of skill have you acquired that prior to coming here you did not have?
Honestly, community. How to talk to community in different backgrounds. How to analyze data. And that's pretty much something that I learned that I wish to use it in the future.
Okay. So do you anticipate where you want to go from here? What do you think your short-term goal and long-term goal, if you want to share with me?
Long-term, short-term goal is basically getting more experience in community health, and then long-term will be getting a full-time job helping the community.
Do you have any prospect maybe into which area you want to be practicing, you want to be serving the community?
Yeah, I want to go to environmental.
Environmental health, okay.
Environmental health, yes.
Have this young graduate here at the National University, graduating from the Department of Public Health. Let me just ask you, can you introduce yourself?
My name is December Sniff.
Okay, and
My name is Elizabeth McGuffey.
okay. So, what motivated you to get into the program of public health?
For me, it was growing up, I wanted to be a clinician. I wanted to go and be a physician eventually. And then the COVID-19 pandemic kind of shifted the way I viewed healthcare in general, and looking at the field of public health as a way to do what I wanted, but on a larger scale, because I always wanted to go in for it to help cure and prevent conditions.
And you?
For me, my dad was diagnosed with cancer in 2016 when I was a freshman in high school. Then, of course, as I was graduating, the pandemic hit, and he was one of the immunocompromised people that were at a very high risk for complications. But he was also considered an essential employee, so that's how I really got into the field of learning how diseases are controlled and prevented in order to protect people like my dad who are immunocompromised, and just people in general who are more vulnerable for these diseases.
So, if I'm
In general, most master's programs are challenging. Ours is no different. However, the program itself is so close-knit. It's small, which is good because we all have we have smaller class sizes, and we are all very close with our professors. We've seen them from day one, and really having that option available to us to be able to talk to them and have them to grow and learn from as mentors within the program has been my favorite part of the program, especially with our classes, the way they're designed. We have gotten an opportunity to explore all different realms of public health. So we all are going out of this, I think, not necessarily knowing what we want to do with our degrees, but knowing all the possibilities we can do with our degrees.
So thankfully, in your first year of the program, it's expected that you take your statistical course along with epidemiology, and those really give you the foundational basis for all of the presentations, research papers, etc. that you're going to present throughout your time here in the program. So I would say even then, you have these foundational skills, and as you're performing the data analysis, the research yourself, you're learning more and you're teaching yourself how to do these things. And the professors are also always on standby, to help. Especially, and since they all have had their doctorates, they have been in this field for so long, they are picking up these skills quickly so that they are able to teach the students as well. So it really is, I would say it's half you are learning the classes and half it's just a genuine interest in wanting to learn more and teaching yourself these new skills.
During the ceremony, Professor Anthony Worth encouraged the graduate to go out and use the skill and knowledge they have acquired to create a positive change in their community and beyond.
Good morning. Distinguished faculty, proud families, friends, recipients of Certificate in Public Community Health, Marshall University Master of Public Health class of 2026. Today marks a milestone that represents years of hard work, dedication, and a relentless commitment to something bigger than us, the health and well-being of our communities. When you first began this journey, you stepped into a world still healing from pandemics that redefined our daily lives to social and environmental challenges that evaluated our systems and our spirits. Yet, through it all, you study how data and human stories side by side. You learn that public health is not about preventing disease, it is about promoting dignity, equity, and hope. The foundation you have built here at Marshall is steeped in community values, from rural outreach projects in Appalachia to data-driven policy initiatives. You have learned that change often begins one person, one program, one small victory at a time. Those experiences have prepared you not just to find jobs, but to strive for transformation. As graduates of this program, you understand that the future of health is not built in hospitals alone, but in schools, in neighborhoods, in workplaces, and policy halls. In the years ahead, you will be called to lead, sometimes loudly, sometimes quietly. You will face moments when data will not be enough, when politics or fear overshadow truth. In those moments, remember why you started. Remember the communities you have served, the mentors who believe in you, and the classmates besides you who share this journey. You are the new stewards of public trust. You are the bridge between science and society, between evidence and empathy. You are the voice of those who cannot always speak, and the advocate for those who are not always heard. So as you walk across this stage and into your next chapter, carry forward the spirit that defines this university: resilience, compassion, and the courage to be effective no matter how difficult it is. As you begin this journey to change the world, never forget your loved ones, parents, spouses, and in many cases, even strangers who cheer you on as you strive across the finish line. Congratulations, class of 2026. The world needs your voice, your vision, and your heart now more than ever. I join Dr. Michael Pruitt, Dean of the College of Health Professions, to congratulate you for accomplishing this milestone. I wish you all the best on your next chapter. Thank you. Go her.
In addition to the holding of master degree graduate, students who completed community certificate in public health were also recognized, many of whom were parents and members of the minority communities.
My name is Margaret Walker. I've had a great time taking the classes for the Community Health Certificate Program, and I've really enjoyed it.
And what do you think, what we want to do in this?
I really took the classes just to see. I haven't been in a college setting for over 8 years, so I just wanted to see if I could actually do it, have mind to study and write papers and all the good stuff. But I don't know. I haven't decided if I'm going to do anything else or not.
So how was it to you after being out of classroom for very long, sitting and writing paper and maybe submitting group presentation? How was it like?
It was kind of stressful at the beginning, but once I got the hang of it, I kind of learned how to do it.
Just typing on the computer?
Yeah, on the computer, yes, and looking up stuff and trying research and reading and looking up and reading. It was intense at first, but I got the hang of it. Yes.
Okay, thank you so much.
This year holding ceremony witnessed a higher number of graduates compared to the previous years, reflecting the growing interest in public health education and service. Ernest Kumba for Gaza Media.